the Mastery Mindset podcast channel. Master your mind and unleash your potential. Welcome back to another episode of our podcast, where we dive deep into important topics that impact our lives. Today, we have a thought-provoking subject to discuss: the impact of stigma on mental health care. This topic holds immense relevance, especially for the working-age population who often face unique challenges when seeking mental health support. Before we delve into the details, let's take a moment to understand what stigma is and how it affects mental health care. Stigma refers to the negative attitudes and beliefs society holds towards certain individuals or groups. When it comes to mental health, stigma can be a significant barrier to accessing care and receiving appropriate support. It can manifest in various ways, such as discrimination, social isolation, or even self-stigma, where individuals internalize and feel ashamed about their mental health struggles. One way stigma impacts mental health care is by discouraging people from seeking help. Many individuals fear judgment or being labeled as weak if they admit to experiencing mental health challenges. To illustrate this, let me share a practical example. Imagine a working professional named Alex, who is dealing with overwhelming stress and anxiety at work. Alex is a dedicated employee who has always excelled in their career. However, recently, the mounting workload and constant pressure have taken a toll on their mental well-being. Alex finds themselves experiencing sleepless nights, persistent worry, and a sense of constant dread when faced with work-related tasks. Despite needing support, Alex hesitates to reach out for fear of being seen as incapable or unreliable. They worry that by admitting to their struggles, their colleagues or superiors might question their competence or even question their ability to handle future responsibilities. Alex's fear stems from the deeply ingrained stigma surrounding mental health in the workplace. The prevailing belief that mental health issues equate to weakness or inability creates a barrier for seeking help. This fear often prolongs suffering and prevents individuals from accessing the care they deserve. Unfortunately, Alex's situation is not uncommon. Many working professionals face similar challenges, silently carrying the weight of their mental health struggles for fear of the repercussions they might face. It is essential for us to recognize that seeking help is not a sign of weakness, but rather a courageous step towards self-care and personal growth. To break down this stigma, workplaces need to foster an environment that prioritizes mental health and encourages open conversations. Employers can play a significant role in this process by implementing policies that support mental well-being, providing access to confidential counseling services, and promoting work-life balance. It's also crucial for colleagues to create a supportive and non-judgmental atmosphere. By showing empathy and understanding, we can help create a culture where individuals like Alex feel comfortable seeking help without fear of negative consequences. Another consequence of stigma is the limited resources and funding allocated to mental health care. Due to societal misconceptions and lack of awareness, mental health services are often underfunded compared to physical health care. This disparity can lead to long waiting lists, limited access to specialized treatments, and inadequate mental health support in workplaces. Let's explore an example to better understand this. Consider a company that allocates a minimal budget for employee mental health initiatives, resulting in ineffective programs and neglecting the holistic well-being of its workforce. It's crucial to recognize that stigma doesn't just affect individuals seeking help, it also impacts those providing care. Mental health professionals often face challenges in advocating for their patients due to societal biases. For instance, therapists may find it difficult to secure funding for innovative treatments or struggle to combat stereotypes associated with their profession. To highlight this, let's consider a practical example involving a psychologist named Maya, who wants to implement a cutting-edge therapy program for her patients. However, due to stigma and limited financial support, her efforts are met with resistance and lack of resources. Overcoming stigma requires collective effort and systemic change. Education and awareness play a pivotal role in challenging misconceptions and fostering a supportive environment for mental health care. Organizations and institutions can take steps to prioritize mental well-being and promote a stigma-free culture. For instance, companies can implement employee assistance programs, conduct mental health training, and provide access to counseling services. By normalizing conversations about mental health, we can create a space where individuals feel comfortable seeking help without fear of judgment. To inspire and motivate you, let's take a moment to reflect on the experiences of some notable figures who faced mental health challenges and overcame societal stigma. One such remarkable individual is Abraham Lincoln, the 16th President of the United States. Despite his monumental achievements, Lincoln battled with severe depression throughout his life. His struggles were so intense that he often referred to his depressive episodes as his black dog. Despite facing personal and political setbacks, Lincoln persevered, guided by his unwavering determination to make a positive impact on society. His ability to rise above his mental health challenges serves as a testament to the strength of the human spirit and reminds us that resilience can prevail even in the face of adversity. Another inspiring story comes from the world of music. Ludwig van Beethoven, one of the greatest composers of all time, battled with bipolar disorder. His manic and depressive episodes often left him isolated and in despair. Despite these struggles, Beethoven channeled his emotions into his compositions, creating timeless masterpieces that continue to inspire millions. His ability to find solace and purpose in his art reminds us of the transformative power of creativity and the human capacity to transcend mental health challenges. Let's also draw inspiration from the story of Halle Berry, the renowned actress and Academy Award winner. Berry openly shares her experience of living with depression and how it has shaped her journey. She has become an advocate for mental health awareness, using her platform to challenge stigma and encourage open conversations. Berry's courage and vulnerability remind us that mental health struggles do not define us but can be a catalyst for growth, empathy, and the pursuit of positive change. These stories, and countless others like them, serve as powerful reminders that mental health struggles can affect anyone, regardless of their achievements or success. They demonstrate that even in the face of societal stigma, individuals have the resilience and strength to overcome adversity, find their purpose, and make a meaningful impact on the world. In conclusion, the impact of stigma on mental health care is far-reaching, affecting individuals, communities, and society as a whole. We must strive to break down the barriers and create an inclusive environment where mental health is prioritized and supported. By promoting education, awareness, and compassionate care, we can ensure that everyone has equal access to the resources they need to thrive. Remember, mental health challenges can affect anyone, regardless of their professional accomplishments. It is through empathy, compassion, and a collective effort that we can create workplaces that value and prioritize the well-being of their employees. If you or someone you know is struggling with their mental health, I encourage you to reach out for support. There are resources available, both within and outside of the workplace, that can provide the care and assistance you deserve. Together, let's work towards breaking the stigma and creating a world where mental health care is readily accessible and embraced. Thank you for joining me today on this journey of understanding the impact of stigma on mental health care. I hope this discussion has shed light on the challenges we face and the steps we can take to bring about positive change. If you found this podcast valuable, I encourage you to subscribe to our channel for more insightful content like this. Remember, your voice matters, and together, we can create a future where mental health care is stigma-free. Take care of yourselves and those around you. Until next time.